And I'm sorry, guys, but I really, after reading this week's news, it was like, oh, okay, stupid mistakes that dentist made this week. Episode 27 of 4,000. I mean, it just never ends. So we're going to sprinkle it a little bit. First, let's talk about a few bad apples that did go to jail. So I feel pretty safe about talking about him now. The first was a dentist and his brother out of Pennsylvania who were recently charged for $32 million of fraud to the U.S. government. They will be serving time in prison. I'm not sure if their sentence has been fully determined yet, but the list of charges against them: visa fraud, conspiracy, money laundering, obstruction of justice. I mean, there's just a laundry list of things that these two were up to. They got the office manager who was also involved with it. They could face up to 400 years in prison, which is kind of a joke, but you know what I mean? Like the sentence is pretty hefty for this one. So if I were to express any PSA from that particular story, if this happens to be you right now, maybe knock it off, because obviously they take this very seriously. Another poor dentist out of Alabama, he's now going to prison for 15 years for setting his practice on fire. He was trying to burn it down for some insurance payments, as alleged in the case, to pay off some really bad debt, gambling debt, I think, that he had materialized over the last couple of years. And then he went back to the office late at night and caught it on fire with some gasoline. The problem was he blew it up, and then he blew up the adjacent business, which just happened to be the Alabama State Trooper office. So I'm sure they didn't take super kindly to being blown up. They probably thought it was a hate crime or something. Anyway, so he's been charged for 15 years in jail. So if you're looking for his practice, it's probably got an associate working there right now. All right, a couple of interesting stories now that we've worked through some of the dumb mistakes that dentists have made this week. There was an article that was published. It was a Vanderbilt and Jada study that came out. They looked at 37 Egyptian mummies. And interestingly, they saw a co-occurrence of dental decay, bone loss, and vascular calcification across both sexes. What does that mean? What the heck did I just say? That means that the comorbidity of periodontal disease, oral infection, and atherosclerosis of the carotid arteries and the heart have long been correlated, way before potato chips and Dr. Pepper were a part of our daily routine. So, what should we take away from this? Yeah, I think diet plays some role in this, but man, there's a bigger problem with inflammatory diseases like periodontitis, and we have to get super serious. The medical community in particular has to start getting super serious about the contributory factors that are often seen with periodontitis and many other health-related problems. This mummy study verified the fact that even when all they were eating was a pretty whole foods or Mediterranean diet, we still saw the correlation of periodontal disease and carotid artery and atherosclerosis disease. So there's something to take home from that. All right, last story. Let's talk a little AI. Recently, just this month alone, we've seen an uptick of some laws starting to be banted around a little bit on the state level about how to handle AI in the medical space. Recently, New York has proposed a law as recent as of March of this year, talking about whether or not AI can be used to provide medical and dental advice, healthcare advice in general. So they're identifying medicine, nursing, dentistry, and psychology as areas in which chatbots should not be able to provide commentary or advice. There are several other laws on the books in other states. Illinois has one that has banned AI-powered therapy services. Nevada has another that will not allow operation and advertisement of AI systems designed to provide professional mental health or behavioral therapy. California, as of 2026, created a law that targets AI systems that falsely suggest they are licensed healthcare professionals. And Utah enacted in 2025 a law that mandates clear disclosures for mental health chatbots and requires them to protect user health. A lot of activity in this area. Look, I love AI on the diagnostics and support side. We are using that routinely in our practices with many of our AI partners. But when those chatbots are starting to give medical advice to our patients, there is a higher level of concern. So it's good we're discussing it. It's good we're debating it. I'm sure we'll find a happy medium somewhere in between. But with that, that's the news.